But Freud actually believed that those who are embracing thoughts related to God and religion are actually delusional. And it's an attempt of repression, meaning what they're attempting to do is to keep certain psychological information that's too uncomfortable or that's inconsistent with what they believe is acceptable out of conscious acknowledgement. And that religion was man's way of dealing with the uncertainty of life, that there really was no God. Now, if we read some of Freud's readings, we recognize that he's an atheist. But the bottom line is we adopted some of those viewpoints from those kinds of viewpoints. And science, for all of these decades, have no longer used spirituality and religion when we're treating clients and patients who are dealing with a number of medical and psychological issues for that reason. So, I don't know how that happened. What mattered? Sorry about that. So ultimately, let me just read really quickly one of the things that Freud said. Our knowledge of the historical worth of certain religious doctrines increases our respect for them, but it does not invalidate our proposal that they should cease to be put forward as the reasons for precepts of civilization. On the contrary, in fact, he said, those historical residues have helped us to view religious teachings, as it were, as neurotic relics. And we now argue that the time has probably come, as it does in any analytic treatment, for replacing the effects of repression by the results of the rational operation of the intellect. So this is all just a rational operation of the intellect, but it's not true. So that was the viewpoint, and that has been the viewpoint up until probably the last few decades, just the last 20, 30 years, that we're now viewing and seeing and observing spirituality is actually having some significance. So this slide says now where we are, a more progressive movement, that there's a potential healing aid because of this factor which we call faith. Wow. So faith is intense believing in this church, and I'll be a little bit more broad because oftentimes when I work with various ethnicities, I have to acknowledge that not everyone is Christian. Not everyone believes in Jesus Christ, although I do, but I have to also recognize and acknowledge that there are certain spiritual principles that I believe God placed, and Dr. Eve was kind of mentioning some of those and others as well, but there are certain principles that are spiritually based that God placed in the earth that we can use. So regardless of what a person endorses as their spirituality, I will find a way to bring it into the therapy process. And I'm therefore encouraging our medical professions to find out, ask those questions, which we'll talk about a little bit later, that's going to help the prognosis of various medical conditions and cancers. So that there is a potential, let's go back a little bit. There is a potential healing aid because of this faith factor, which lends itself to the knowledge being progressive. We can't fully put God, we can't put God in a box. We can't contain it. As much as we think we know, we don't know half of it. And so what that means is we've got to allow ourselves, allow science, allow all of these medical professions to recognize that there are some things that we just don't know and that we have to acknowledge the fact that we don't know it. Ultimately, there has been an increasingly large number of researchers who are taking an interest in religion and spirituality and how it can be used to help health conditions. Prayer. Prayer is a major protective factor across cultures. And I brought this book up here. I'm not going to share a whole lot about it because I'm recognizing time. But this book is called, it's a gentleman who's from Japan, and it's by Masaru Emoto. He's a Japanese writer and a scientist, and the name of this book says, Love Thyself, The Message from Water. That's why I really like that presentation. The message, you're familiar with it as well, Dr. Parker. This book, this scientist from Japan developed a way of freezing water and studying the crystals that result from frozen water. And this book has pictures in it, pictures of words that were propped up towards containers of water and then frozen. And once they were frozen, he gathered the information from these crystals and realized that the crystals were either stable or unstable based on the energy that was projected from this water. And the words that he placed up to the containers of water were words like love, God, acceptance, forgiveness, and then also in another set of research, he put words up such as evil, hatred, murder, killing, and found that the crystals were completely different based on the energy that was produced, the vibrations that were produced, the radiance and the resonance that was produced. And we know that we're over 75% water. So what this tells me is what science has been looking for, which says that God made it so that our bodies respond to prayer. Our bodies respond to believing in this faith factor that we talked about. Our bodies respond to connecting with people. Our bodies respond to believing that even though this doctor is giving me this diagnosis, I know that there's a greater power. And I know that this is not a death sentence. So there is something that's being released that science hasn't been able to prove, but this gentleman has been able to identify that there is something to the water that changes when we place words next to it. So when we're thankful, when we're grateful, when we express those kinds of intense emotions, our body chemistry actually changes. Our neurology actually changes. This stuff excites me, so I better calm down a little bit. Trying to maintain myself. So, the faith factors. Again, we're trying to put this within the context of what science would like to endorse. But this is what I'm ultimately trying to encourage. I'm not done yet, but ultimately I'm trying to encourage that we've been missing the mark. We've been missing a grand and great potential that God gave us, which are some of the things that I'm talking about. So faith in God, in the goodness of God. There are certain things that I believe that we have to keep in mind. And that is, if we believe that there's a God who's standing by and going to strike you down and not going to forgive you and going to throw you out, and all that kind of mentality also has an effect on a person's body chemistry, of course. We understand why now. But having faith in the goodness of God, some would say the source of life or a higher power. Again, I've got to think about the fact that sometimes various ethnicities don't believe in God, don't believe in Jesus Christ. So I include this particularly for the healthcare professionals, so that you're not stuck in a box because a person says, I don't believe in God. Again, there are spiritual principles that God placed in the earth. So when we're talking about the kinds of foods, we're talking about water, we're talking about how to take care of this temple that God gave us, those are principles that even though you may not endorse God, they still work. So if you take care of that healthy body, God just set it up that way. So regardless of what they define, God still has certain principles that if we will apply them, they will work and they will operate. So faith allows one to endure tragedy and uncertainty and to continue to engage in life despite the presence of illness and fear. Meaning and purpose in life. It makes life make more sense. It gives a feeling of certainty and that I'm here for a reason and here for a purpose, which impacts our psychological mindset. The power and the force of prayer, which we mentioned. So ultimately what we're saying is that belief in prayer increases positive cognition, which we as psychologists love to explore and love to talk about, because we know that it impacts emotions and it impacts the biology of a person and it impacts their behavior, and all those things interact with one another. And ultimately it increases the positive chemicals, those neurotransmitters that we were mentioning earlier. And then those positive neurotransmitters increases the positive emotions that we have. Those emotions are intense feelings, and we are feeling beings. And that is another one of the principles. God gave us these multifaceted approaches to understanding humanity, which we'll get to shortly. But I think what I need to do is move beyond this, because I think we get it. I'm going to move beyond that as well. This is what's important. The relevance of spirituality as a cultural competence issue. Within the United States, we are highly religious. 96% of us profess a belief in God or a universal spirit. This is according to Worthington and Sandage. Not a whole lot of research is being done on spirituality in medical fields. It's increasing, but not a whole lot, not a preponderance like we're wanting. And there is, but it's increasing. And 92% are affiliated with religion. They identify themselves as being religious somehow. 90% pray. 71% are members of a church or synagogue. 57% pray once a day. 42% attend worship weekly. And 88% say that religion is very or fairly important to them. Therefore, the implications are we need to be asking the questions. We need to be having the assumption that our clients and our patients, that they have a spiritual belief system. We'll define spirituality and religion in just a few minutes. But this tells us that we're missing something because we're believing that there is something beyond ourselves, that 96% of us believe in God or a universal spirit. So the role of spirituality in health. Study was done in 2003 examining the relationship between health, whether it was healthy or whether it was more harmful. And what they did was they surveyed over 2,000 physicians. And these physicians were of various specialties. Some of them were some of the kidney doctors and urologists and various different kinds of medical physicians. And over 65% of them responded. And what they found is how often patients mentioned they were wondering how often patients mentioned spiritual issues, how much these issues influence their health, and how that manifested. That was ultimately what they were looking for. And what they found is that 63% of the physicians stated that, 63% responded. So 1144 out of 1820 responded. And what they found is that 56% reported that much or very much of an influence